I'm humbled, and honestly, I'm just so happy that you guys are here to celebrate the work that we do. But before I tell you about our extraordinary work, I wanted to share a story. Marcella Orozco is a health coach with the Care Ring team. Marcella told me that for several months now, she has been working with one of our clients, a 44-year-old female. Recently, Care Ring was able to line up a mammogram for this client, and she was then diagnosed with breast cancer. We were able to get her into Physicians Reach Out, where she saw a number of volunteer oncology and surgical specialists. Just over a week ago, our client had a mastectomy, and Marcella called her to see how she was doing. Marcella told our patient that she is so appreciative of everything Care Ring has done for her. Although she was in the hospital and in some pain due to her procedure, she was so joyful and thankful for being able to have access to the care that she needed. She said that Care Ring and Physicians Reach Out saved her life, and that is enough to be happy about. This story sings to me on so many levels. We have an incredibly generous community. Multiple medical professionals, hospital systems stepped forward in just this one case to volunteer their talents, to give away what they do to care for a member of our community in need. One of our neighbors was alone. She was afraid, unsure of her next steps, frankly terrified of the future. She desperately needed access to care. She needed our community to care, and our community responded. There are so many stories of hope and renewal and revival that happen at Care Ring every single day. That was just one person whose life has been touched by us. Every day, we do this across Charlotte in the homes of nurses, in the homes that our nurses visit, in doctors' and dentists' offices, in every corner of the community. We do this in our own clinic in Uptown Charlotte every day. But there's a bigger issue going on in Charlotte, something that transcends just the health and wellness of those that we care for. It reaches deeply into the community. Remember for a moment that we were, about 2.5 months ago, originally scheduled to have this luncheon in this very room. But following the shooting of Keith Scott and then the unrest that unraveled Charlotte and overwhelmed Uptown, we needed to pause on our party. You see, there was something going on in this city, something beyond just the tragic events of that night, something that we at Care Ring have been working on for more than 60 years. For far too long, many of us have accepted that there really are two Charlottes. There's a prosperous, upward climbing, happy warrior, the sun is always shining Charlotte, and there's another Charlotte. One that has been neglected for decades and one where there is sadly little hope of climbing up. Most of us have at least been aware of this situation. We have known about Charlotte's arc of poverty that goes around Uptown Charlotte, the necklace of neglect. We've known in our heads and probably in our hearts that there are neighbors living in zip codes not far from where we're sitting today that have some of the highest rates of poverty in the state of North Carolina. And while this is true, the good news I've come to share is that in recent years, and certainly in just the last few months, the light is shining much brighter on this issue. Today I have more hope than I have had in the 15 years since I moved back to my hometown of Charlotte that we, and I mean all of us, not just this room, but this community, we are going to take the time and build the coalitions and see to it that we have the will to finally not only admit we are in this situation, but commit to doing something about it. Einstein once said, in the middle of every difficulty lies opportunity. And we are seeing positive developments on this work bloom like roses all over Charlotte. From the Opportunity Task Force to the One Charlotte Initiative, it is remarkable the show of solidarity and commitment to truly dig in on these divisions in our community and make a commitment to make a real impact on people's lives. As the leader of a health and wellness agency for those with limited resources, I applaud these efforts. I'm particularly excited about the recently announced Novant Health and Carolina's healthcare system partnership to improve the health status of folks in our city and directly address disparities in healthcare that unfortunately plague far too many of our neighbors. This is potentially a historic partnership with two critically important healthcare institutions dropping their competitive postures and deciding that this issue of helping those on the margins of our healthcare system is something much bigger than any one institution could possibly handle. I believe that we are truly at a watershed moment in Charlotte's history. as we have both a responsibility and an opportunity to bear down and address the health disparities that have bedeviled our city for decades. Caring is ready to go to work. We are ready to make a difference. We are ready to do this together with you. Nearly 7,000 of our neighbors, every one of them an individual with limited resources and representing the broad diversity of our community, rely on us, lean on us, depend on us for success with their health and vitality in their lives. Our clinic in Uptown Charlotte has a highly effective and growing chronic disease management program. In a few short years, this program has seen tremendous growth. Today, taking care of nearly 800 of our neighbors through healthy exercise, eating clubs, and by connecting folks to food pantries and so much more. More than half of the physicians in Charlotte volunteer with Caring to care for those unable to get public or private insurance. Thank you for giving back. Last year, these doctors, and increasingly more dentists as well, gave back nearly $13 million in services that they did not charge for. Every day, heroic nurses on our team and Nurse Family Partnership go into homes and neighborhoods that most of us will never visit, and they literally transform lives, leading to healthier babies, moms prepared for motherhood, and over time, a pathway out of poverty. Our staff, our clients, our work is rooted in the very communities that feel so disenfranchised and are often marginalized in our society. I am so grateful and excited each of you has chosen to be here today to learn more about Caring and hear our vision for the future. One of the things I truly love about Caring is that our support goes out to every one of our clients. I keep a sign on my door at Caring of the London Underground subway system visual, Mind the Gap. This visual cue is designed to keep passengers wary of their steps, to be careful as they proceed onto the London subway. I've shamelessly borrowed this visual for Caring. For us, this message is a daily reminder of why we exist, why we care, and why we can never forget about the people we are privileged to serve every day. We are minding the gap in access to affordable, high-quality health care in Charlotte. We help people regardless of their station in life, regardless of the zip code they were born into. A person may be new to this country, we can help them. He or she may be socially isolated, we welcome them. Or perhaps they haven't seen a doctor in decades. Come see us. If we can't help you, we will connect you to someone who can. All are welcome at Caring. This is one of our core values, which the Caring Board revised and adopted just this year. Our values are pretty simple, just 4 words: compassion, integrity, collaboration, and empowerment. These are our values, and this is our vision. We see a community that promotes, protects, and improves the health and well-being of all people. Not some of us, not just those with good health insurance, everyone. We work to empower individuals to get and stay healthy, giving them the tools and the education that they need to thrive. I hope you will embrace our mission and join us in this movement. I invite you to be a part of Caring as a donor, as a volunteer, as a supporter, as a connector. We need you to join us in this work, and I am asking for your support.